Good to have you here. This is going to be a fantastic capper to our season of these events. Welcome online, welcome in person. I'm Josh Mackauer. I'm the co-founder and director of Stanford Musallam Center for Biodesign. And I couldn't think of a better way to wrap up our year here. With someone who began in a company as one of the first engineers and over 30 years rose to build this to a mega powerhouse, 15 years as CEO. But Intuitive Surgical is obviously our close neighbor here in the Valley and really sort of a shining example of what can be done when you actually just go it alone and you build something and you don't sell it, but you just create an entire enterprise, an entire way of doing surgery and innovation. And it's just an honor to have Gary Guthart here, who's now the executive chair on the board for Intuitive, recently retired as CEO. And he will be interviewed by Katie Blevins. And Katie is one of our alumni fellows. I think it was 2016-17, MD, PhD, bioengineer, and now a board-certified general surgeon, also leading a robotics practice at Hoag Hospital. So a really great match for this discussion tonight. I want to just take a moment to thank Wilson Sonsini Goodrich Rosati for their support for this evening, and also thank our amazing team that puts these together. It really is a team effort, and we're so proud. These stories in the Innovator Workbench are really delving into something that isn't normally covered in interviews. This is about the evolution of a career, the evolution of this whole space from the perspective of an innovator like Gary. So take it away. Thank you very much for being here.
Thank you so much, Josh, for the very nice intro. And for Gary, thank you so much for taking your time to share with the biodesign community about your journey and kind of what we have to see. And so just to start, as Josh alluded to, you have had this tremendous career, one of the first engineers at Intuitive. But can you give us a little bit about your background and kind of what set you up to be able to have such a good launching point?
Well, first let me thank Josh, and Katie, thank you. It's an honor and a pleasure to share the stage with you, and I'm delighted to be here. Yeah, a quick background. I studied physics. I came out of a family that was kind of a math science family. I was born and raised here in Sunnyvale, California. It was a little bit of stroke of luck to be born there in the 60s. I knew fairly early on that I wanted to pursue science. I wound up as an intern at NASA Ames across the street, not far from here, working in human factors for aircraft and pilots, and just like an incredible training ground. I studied physics at UC Berkeley and thought I'd be a professor of applied mathematics. So I got a PhD in applied math at Caltech, and then was advised, rightly so, that I was pretty chatty for somebody who was going to go into math, and I was better in the lab than I was with theory, and I might consider another career. That was hard feedback to get, but I completed that program, and I started with Stanford Research Institute, SRI International, just down the street, and ran into somebody who was running a lab, Ajit Shah, and they were working on surgical robots, and we ran into each other playing basketball, of all things. So this is a story that could only happen in Silicon Valley. We're playing basketball. He's talking about, we're on the sidelines because I wasn't very good. I was waiting for my turn. And he was controlling the surgical robot. He had some struggles with it. And he said, do you know anything about this kind of math? And I said, well, yeah, I happen to. I got a demo on that prototype, SRI prototype. And I stood up after the demo and said, this thing is really cool, and I want to be involved. And so I asked my boss if I could loan labor into that job. Ajit took me on, and from there I met the founders of Intuitive, and it was spectacular luck.
That's awesome. And the luck is a part of it, but also skill. So can you tell us a little bit more about your transition to starting at Intuitive and then your path throughout your time there?
I joined Intuitive in April of 1996. I was the 11th employee. Of that group, roughly 10 people were technical, And they had asked me to be an individual contributor and work on the algorithms that make this telerobot feel intuitive. And that had suited me. I had had that background from human factors and user interface design at Ames, and so I started on that pathway. It was interesting, when I had gotten the offer, I just didn't know how to interpret a startup. I had come out of this kind of scientific background, so the very first thing was, what is a company? What is a startup company? So there was this month and a half of, do I want to go into an environment that was applied rather than kind of theoretical research? And it was one of the founders that had come from the venture capital world, a gentleman named John Freund, that convinced me. He took me out to breakfast and he said, look, you're doing this interesting research. Why don't you see what it takes to see what it's like in the real world? And he goes, if it goes bad, in 2 years, you go back and you'll be a better researcher because you've seen what it takes to actually deliver something rather than talk about delivering something. And if it works, the world opens up to you. We had a 1-year-old at home, and so I went home to my wife and said, this thing could go bust in a couple of years. Are you okay? And she said, absolutely do it. We'll be fine. She didn't hesitate for a minute. Just go. So I went back, called John, and said, let's go. That was really a good decision. That worked out.
That's so exciting. You've mentioned a few people already about kind of that have really kind of shaped and changed that. Tell me about your mentors and leaderships, both kind of inside Intuitive and outside, kind of as you've gone through your course from going from employee number 11 up to CEO.
Yeah, you all have heard this before, and it's so obvious it's embarrassing to say, but I feel like it's important to say, and that is, none of these things are created by yourself. There's always somebody who's either helping you along or pushing you along. I just have found that to be true. So at SRI, my boss was a mentor. His name is Raul Martinez, who's a Marine and a PhD physicist. And he taught me early on the discipline around getting clarity around problem solving before you try to solve. Start with the end in mind. It's the old adage of given an hour to solve a problem, spend the first 50 minutes on defining the problem, and the last 10 trying to solve it. He just drilled that into me. And when I said to him, hey, can I go work on the surgical robot, which was not in his space, he said, do you want to do it? I said, yeah. He said, okay, I'll support you. So mentor number one. I got to Intuitive, and the person who hired me in the technical space was Rob Young. Rob Young, a serial entrepreneur, had been a founder at Acuson Medical Imaging. Some of you will know, a deep relationship with Stanford. And he was spectacular at developing good engineering taste. Develop outstanding technology. Do not make your customers suffer with things that don't work. He was just really intense. So he was spectacular. And then Lonnie Smith, the prior CEO at Intuitive, joined in 1997. And Lonnie was just spectacular at keeping the priorities of the company right. Serve the patients first. He joined us in 1997, small company. He joined from a very big company, Hillrom. And he sat down and he said, okay, look, here's our priority list. Patients first, but we're not a healthcare provider, so we're going to make the MDs happy. So MD success. And the next thing was hospitals have to buy this. So what do hospitals need? They need a return on the investment they make. And then payers have to pay them. So what do they need? They need lowest total cost to treat per patient episode. We need to build a company that employees want to commit to long term. And finally, we need to make our shareholders happy. And that's a prioritized list. And if we ever get it out of order, we will destroy value. And so, he knew it in his bones because he had seen it. And so Lonnie just was so clear, so clear-minded about how to prioritize. It was just drinking from the fire hose. It was spectacular. And he had another trick. Lonnie was just a spectacular business person. But he could teach people in the way, he could sense how people learned. And some of us are visual learners, some of us like to listen to podcasts, some people need quiet to learn, some people need interaction. And he knew I was a reader. So Lonnie would never come in and tell me, you're doing the wrong thing and I want you to stop. I don't think he's ever said that. I've worked with Lonnie or for Lonnie for 20 years. And what he would do when he thought I was doing the wrong thing, a book would appear on my desk. And there would be a Post-it note on it that says, it looks like you're struggling with this problem and the answer lies within. Literally. And then it's a treasure hunt. He knew me, he got me. I was totally manipulated into reading the book, figuring out what the issue was and then coming back and chasing it. It was just spectacular. So yeah, there have been spectacular mentors, and it's just really cool. We'll talk a little bit, if you're interested, maybe in the Q&A, about what makes a good mentor, what makes a good mentee. What does it take to be a mentee?
So despite what an amazing company Intuitive is today, it's not always been smooth sailing. Can you share some of maybe the toughest challenges you've had to lead the ship to navigate through?
Yeah, that's true for all of us. Good stories are only true in hindsight, right? It all makes sense, and we get to curate and weed out. It's like building an Instagram profile. You tell the story backwards, you get to weed out all the ugly. But we all know going through it. How many of you, just if I can see in the room, how many of you have built companies? And so does that resonate with you? Like, the storytelling is the easy part. The actual living it is the hard part. Wow, are there hard ones? So I'll just pick a few. In the early days, success is not assured. You're constantly raising money. Fundraising windows open and close constantly. So you're trying to build this organization, and your window, which you cannot control, is going up and down and up and down. Just generates enormous amounts of stress. So that stress drives creativity, but also a huge amount of working hours. No surprise. So that is probably shared amongst everybody in this room and most people online. The next thing is that once you start to get a little bit of traction, for those who lead as our customers, the surgeons like you who start to first adopt, are they hailed as heroes? No. The reward for being a leader of something that's really new and challenges the status quo is arrows. And so both the company and those surgeons who chose to first adopt were subject to fearsome, unrelenting criticism. There's a waste of resources. It takes too long. It's a marketing gimmick. This is only about billboards, and on and on and on. And so we needed to work through that. And my approach to that had been, this is where the training and some of the Caltech training, being a PhD student, really helped me, which was to be able to withstand a fearsome attack from an honest skeptic. So an honest skeptic, a well-intentioned skeptic, that's good. That actually develops your thinking. So I just never got really freaked out about that. I was like, okay, let's talk. You don't think that it's cost effective? Let's talk about what true costs are. You don't think it's any good? Let's talk about what we're seeing in the lab. Every once in a while, you'll see a dishonest skeptic. And what they're looking for is self-promotion or self-preservation or something else, and you can feel that. In which case you go, okay. But positive engagement with honest skepticism builds strength. Even plaintiffs' attorneys that sue you, some are honest skeptics. And if you can accept the criticism and deal with it, you will strengthen the organization. And so those were hard times, but they built strength. So we've had large companies fund studies that are then handed to shorts on Wall Street who build short positions and attack. That's uncomfortable. But if you believe in your technologies, in your systems, if you can respond to those criticisms with clarity, good things happen. We've been challenged by regulators around the world, and if we can be honest and scientific in our basis and respond with data and clarity, then that strengthens the organization.
Intuitive is an innovator. You're the leader in robotic surgery, but you don't just kind of sit on your tails. This is always a continuing process. So for you as a big company, how do you innovate within a large company and keep pushing it forward to disrupt yourself?
Yeah, I think it's really wild. If you think about things that are common across industry and across companies, I'm a huge, I learned by reading. I'm a huge reader. And so we go out and say, well, who's gone through this before us? And then what can we learn from them? Why learn it the first time for yourself if you can gain insight from others? And so one of the folks that advised us early on was Clay Christensen. It was talked about disruptive innovation, the innovator's dilemma. You all have seen that. Clay was an associate of Lonnie, our predecessor, my predecessor. And so we started to be steeped in that. You know, what is it that you can, as you start getting bigger, how do you avoid these pitfalls? Some of it is structural, some of it's mindset, some of it's incentive-based. And then there's another book we like a lot. It's called Loon Shots, L-O-O-N. Its author is Bacall. And this talks about the tension in a large organization. You have, as you're starting to scale, Intuitive now, 17,000 employees. We impact the lives of over 2 million patients a year. Growth of that is running at 16, 17, 18% a year, thanks to the work of surgeons. And so you like quality, and we're making millions of instruments a year, lots of things that have to be done. So there's a whole engine that says, how do you do quality things at scale? And that can consume a lot of your time. At the same time, you'd say there's enormous opportunities to improve things in healthcare. Like, it's not even close to done. Even our own most successful products are not even close to being where they need to be over time. And so you want to have a different engine that's able to move at a different pace and is not burdened by finding that scale set of issues. And so building incentives, organizational design, and mindset have to be different. And then the art form, and Bacall in his book talks about this big scale side is thinking about coordinating armies. Sorry for that analogy, but it's his. And he talks about this high speed improvisational innovation side as managing artists and musicians. And in the middle, you have to fuse them. And I love that analogy. And so we've built teams, some of whom are in this room, that try to do one of each, recognizing the incentive systems and the pacing and the processes are different, and building respect between the two. The folks who are generals in the field should be respected for what they do. The people who are jazz musicians in the lab need to be respected, and we need to have ways for them to talk and exchange ideas. So that sounds really esoteric, but we've implemented it, and we keep working on it. The tensions never go away. I think it's a tension to be managed, not a problem to be solved.
You had mentioned it with the kind of the total value of care as opposed to cost, because surgery, robotics can be expensive, but this emphasis of value is so important. How did you kind of set your team up, and what is your vision forward about making sure that we are having kind of equitable access and then also just value in the healthcare system?
Yeah, I love that question. It's something that we talk about every single day. It is so forward for us. How many of you have heard of the quintuple aim as articulated by surgeons in healthcare systems? Raise them high and proud. So some. So, this didn't come from us. Quintuple aim is I think it was AMA who has popularized that. It used to be the triple aim, then it was quadruple aim, and now it's quintuple aim. So what is it? Not ours, but theirs. One is focus on patient outcomes. That everything that you do has to be focused on better outcome. But outcome isn't enough. That the patient experience, are they respected? So are you rescheduling them 6 times? You may have a great outcome, but is it misery for them? So patient experience, but the healthcare system is staffed by people who work extremely hard and extremely stressed. So are you helping or hurting the caregiver experience? And all of us know that our caregiving systems in almost every nation that we operate in are under enormous stress, the caregivers themselves. So that's the third aim. Then the next one is it's got to be affordable. Well, that's total cost to treat per patient event, per patient episode of care. It is not the cost of the scalpel, but everybody will revert to cost of scalpel. So I'm going to talk about cost in a minute, but what is the right economic thing? The right economic thing is absolutely total cost to treat per patient event, per patient episode. And then finally, equitability of access. And we think about that. Sometimes people think, well, that must vary by country. Not the right framing. It's true, but it's actually not the right. Well, maybe it varies by city. Go, I'm in a good city. But we've done the analysis deeply. We have very good data analytics capabilities at the company. And it turns out that health equity varies by mile. It's actually by zip code. In any neighborhood you're in, including this one, people will walk into a hospital and they will be offered different standards of care relative to what's available based on a few miles apart. And I am sure that you have seen that. So this issue of equity is really deep. And so it could be how do you reach people? It could be education. It could be the languages you're communicating in. It could be what the insurance incentives are. It could be what the hospital administration thinks is right. It's even worse than zip code. If you show up at a hospital at 4 p.m., you will get a different treatment than if you show up at 8 a.m., and it can be scheduled. Wait a minute. That's actually not best for the patient. That is convenient for the provider. Nobody wants to talk about it. but actually the time you show up also determines what equity is. So those are the 5 things. What we took at the company is every company runs on an enormous number of KPIs, internal metrics and all this kind of stuff. And we had that in the company too. But sometime around 2010 or 2011, I said, let's make sure we are measuring our performance against what our customers care about, which is the quintuple aim, and be serious about it. Go do those measurements. And then if we're wrong, work on it. And if we're right, we'll advocate for it. And so that's kind of been our approach.
For every single person that I've ever talked to has worked intuitive at any touch point always talks about what an amazing leader you are. And it is truly felt in the bones from the top to the bottom across the board. Can you talk to me about building the culture of the team in order to have people love what they do and be passionate about it?
Thank you for the compliment. I'm going to reject the framing. No, I think that cultures are built. I think they're really important. They are I am both a product of and a champion of the intuitive culture. So both are true, just to be really clear. I think it's really one of these things. I don't know that there is one perfect culture. Think of the great companies that surround this campus. Google's an amazing company, or NVIDIA's an amazing company, or Apple's an amazing company. And the cultures are all a little bit different, and who can argue with the results? They're really kind of spectacular. But I do think so I don't think there's one right thing. But I do think that culture is really important. So let's just define it. It's one of those business terms that I think is tricky because, like strategy, it rolls off the tongue easily, but it's actually too broad a concept to really anchor to. So what is culture to me? One is values. And what is it that we as an organization value? And what Lonnie had written down, and I described to you already, and it's the thing that I want every employee to be able to recite, is patients first. MDs are the ones who will recommend us. If the MDs don't recommend us, it doesn't matter. Hospitals need to get a return. They need to feel great about it. That's what we had said. That's what we value. Those are values. The next one is behaviors. How do we behave with each other and inside the company to achieve these ends? And then the final one is methods. How do we encode our values and our methods so that they can be taught and evolve with us as we go? What is it like methods? Like Zoom is a method. So what do you do on Zoom to help teach culture if that's what's going to be important? So I think if the leadership lives it, it'll pervade. You can define it, you can put it on your walls, you can put it on your website. If you don't promote those people who do it really well and remove those people who cannot do it, it doesn't matter. So I think you have to both be intentional and you have to make sure that the leadership embodies those things you say. And that job is never done. It's never over, it's never fixed.
Nice. Now, you have recently made a transition away from CEO, given the reins to Dave, and are now chairman of the board. Can you tell me about that transition and how things are different for you?
Sure. I think transitions are important. While I've been at the company now, it's going to be somewhere between 29 and 30 years, almost 30 years. I've had a new job about every 3 or 4. So I just happen to have a new job within the company. And I think challenging ourselves, it could be a new technical job if you're a technical person, it could be a new marketing vertical if you're a marketing person, it could be a new general management job if you're a general manager type. But rotations are important for strength, not just for your own personal development, but actually to infuse oxygen through the organization. So I think that organizations ought to have permeable boundaries. And we have a venture team, we have a business development team, we have research groups, we fund fellowships outside our company. We do all these things to make sure that our boundaries are permeable so that oxygen and ideas and people can flow in and out of the company to avoid stasis and calcification. That includes me. So I think that the organization can over-habituate to its leader, and the leader can over-habituate to the job. And I could start to feel that. So I had sort of thought of the CEO leadership job in thirds. First third is learning the job and figuring out what the key strategic initiatives and priorities are. The middle third is about delivering on those things. And the final third is to set up your successor for great success. And Dave Rosa, a spectacular leader, knows the company inside and out. As I move out and he moves around, it creates oxygen and opportunity for a whole layer of other people. And I think that's wonderful. And I will go find interesting things to do. It's good.
You talked a little bit about kind of next steps in building up. Can you tell us a little bit more about the kind of future for robotic surgery with AI? Intuitive is so much available that's up in the coming that we keep hearing about. So,
yeah, I think we're living through a spectacular time of opportunity. It is certainly challenging, right? Our health systems, total cost to treat per patient episode. So let's just zoom out. You go first, we have not conquered many diseases. There's enormous opportunity. Second, for all of you in healthcare, you know this better than I do, I always like to have the image of flying behind the patient, and I've had to do this in my family and my life, I'm in the middle of it now, and just saying, who designed this care pathway from diagnosis to full recovery back at home? Just take your notepad, for all of you who do this, and you walk through it and you go, this is insane. Nobody designed it. Now, an incredible number of very talented people work very hard in healthcare to deliver great care, but it is so complex and it is so multifaceted, and we are so specialized that the handoffs are brutal, from diagnostics to prep for surgery to post-op to the coordination with oncology plus drugs plus maybe a little radiation and all those kinds of things. It, from the patient's perspective, is overwhelming and really hard. So you had asked me the question, what's happening, what's our opportunity? I think all of us would say if we could snap our fingers, disappear, come back in 30 years, our technologies that we're dealing with today should look antiquated, and they will. Even our most advanced ones should look antiquated. Isn't that our job? And we're living in a time where biology has gone from an observational science to a design science, to an engineering science. We're working through a time where computational resources are exploding. It gives us a huge opportunity where material science is in front of us. We're also living through a time where we have demographic decline in most nations, which means who are the largest consumers of healthcare? Those of us with gray hair and those who are getting older. We have too few people moving into the medical field. We have more people who are needing that care, and we have a lower employment base to fund healthcare, which almost everywhere, including the United States, is funded by the young. So we are going to be, all of us, have a massive mission that is at least threefold in dimension, and it's getting harder. Make sense? So I look at that and go, that is both daunting and an enormous opportunity, and we ought to get on with it. Okay, so where's it going? Robotics is interesting. For those of you who think hardware is a solved problem or hardware is dead, you're wrong. I think you're wrong. There's enormous opportunities in better hardware. Software is an enormous opportunity. AI is an interesting set of tools, highly differentiated. So can we do AI for decision support? It's coming. How about for ambient listening and ambient learning to help with documentation burdens? We see some really interesting things. How about embodied AI that allows some subtasks or other tasks to be fully captured by a robotic system to offload some of the needs of the surgeon? How about remote interventions that allow experts at a large distance to be able to interact? I think these are all fruitful areas for opportunity. I think we're in a frothy period, and as a result, I think some of these ideas will lead to dead ends, but some of them will be spectacular.
Awesome. We have a lot of everyone in the spectrum, senior career, junior career, students and everything like that. What advice would you give to someone who's starting out for innovation in medicine, in healthcare delivery? What advice would you give to them and then to your younger self?
Well, first, I think you've chosen a field that is exceptionally rewarding and exceptionally hard. So what does healthcare attract? Who does it attract? And, I'll quote one of our board members who has since passed. We had a board member named Fred Loop. Fred Loop is a cardiac surgeon and was CEO of the Cleveland Clinic. And Fred said, hey, to us, and he writes in his book, Leadership in Medicine, healthcare is different than every other business. It starts with helping a person at their most vulnerable to detect and improve a disease. And never forget it. We're not mercantile, we're not consumerists, we're people who are working hard to help somebody in their moment of need. And who does that attract? So it is hard. If you're an impatient person, you can go into many other fields that are not this. This requires patience and a long-term perspective. How many years of training did you go through before you could help somebody? A lot. So if you're impatient, it's probably not for you. But if you're patient and you're called by that mission, I think it's spectacular. So the first thing is just check yourself. It's going to be long and hard. If you like long and hard and you can help people, then you're going to love this. Who do you want to work alongside? People who are likewise committed and really into the mission. So that attracts good, right? So I think those are really good. The other thing I would say is that things that look revolutionary only look revolutionary from the outside. From the inside, it looks like decades of hard work. And it's true if you worked on cell phones, it's true if you worked on DNA sequencing, it's true if you worked on surgical robots. Or an overnight success, decades in the making. That is another part of this. So my biggest compliment to anybody, I can work with just about anyone. What I feel like is those people I want to work with they don't have to be serious people, but they are serious about their craft. They are committed to the mission. They are collaborative because healthcare is foundationally collaborative. If that is you, you're going to love it.
That's great. There's always new applications, new data coming out and ways. So how do you, as a company, kind of driving through for kind of off-label indications for your technologies? People are coming out and it's a moving picture all the time. So tell us about, I guess, how you navigate and help and kind of control how your instruments are being used.
Yeah, so these things are tools, and surgeons are creative. There's a segment of surgeons who are looking for better, and that makes sense, right? The surgical practice, it isn't so much that we're not to the place of fully automating the intervention, and which means that there's room for people to explore. The off-label, what that means for a company, we are highly regulated and should be. That makes perfect sense, which is what can the company promote? What can a surgeon do? It turns out that healthcare providers have different requirements around technologies, and that's true if you're prescribing drugs, it's true if you're a practitioner. And so they'll think about that. And the regulators look at companies and what the healthcare providers are doing differently. So it's important to know our roles. They will look out, and the practitioner community will look out and say, where can we take this? Where can it go? In some cases, FDA will expect of them high degrees of rigor. In other cases, they think that the devices are lower risk and they'll allow more freedom. And other countries will also regulate differently. So what is on label in one country may be different than what is otherwise. The role of a company is to be listening and to satisfy the regulations and to listen to where our customers want to take us and do that with some discipline. What I would say is that almost all the great indications for many of our current procedures that are being performed came from the collaboration of surgeons who are interested. We didn't sit in a white room, design it all perfectly, get it all done on a whiteboard, and then turn around and then deliver it to them. So they come in and say, hey, we're stuck here. We're struggling with a set of problems. We go observe in their environment. What are the problems they're struggling with? And that iterates. So you need to be in touch with the surgeon innovators to find out what are they struggling with, where do they want to go, and then find the right regulatory pathways to allow them to deliver.
Nice. Can you tell me about a really hard time that you've had to make a really tough decision as a CEO?
Lots of them. I'll hit two, but that could go on and on. I think a couple. On the strategy side, there's this thing of, and it's true for any entrepreneurial effort or startup, where you could go with your technology and what you can afford to do and what you have attention for, management attention for, are in conflict. And so you're choosing between 2 or 3 really good options, and you have to stop or shelve a couple. And that is really a tough call. And our message to our staff is we commit to our employees, we don't commit to their projects. And that is true. Like, look, You may work on a project and we may have to make a hard decision and park it or really set it aside. And what we hope is that we'll find a spot for you. We have a lot of work to do. But some people will look at that and say, no, identify with that project, not with the company. And when you do that, I've been called every name in the book. I've had some really embarrassing screaming directed my way. People have quit in anger. Those are hard. But if you avoid them, you put the company at risk. And so we've had to go through that. I think that's one set. I think another set, and this is a model that Lonnie Smith had developed, and he had said, when you're evaluating your staff, your leaders, you want to look at how do they deliver against their results and what are their behaviors like. And he said, deliver the results and believe the beliefs. That was his 2x2. And so somebody who delivers results and is very good behaviorally, that's great. Those are your stars. He goes, somebody who is struggling to deliver results and is dishonest or otherwise doesn't want to work, it's uncomfortable, but it's not hard to decide what to do. The corners are the hard ones. You have somebody working very hard, struggling to deliver. And there you give somebody a second chance to try to coach them, but if it keeps going, you have a problem. And he goes, but the hardest one, somebody who delivers results but whose behaviors are corrosive. And the organization will hesitate to deal with that because they're addicted to the result, but they'll allow for cultural corrosion if you do it. And so that happens from time to time. It is the hardest of the management jobs, I think, is to step up and say, I'm going to not accept corrosive behavior, even though this person is delivering what we're asking of them. Does that make sense? And that happens, and you just have to recognize it and step up to it, but it's never fun.
You've already mentioned that you're very responsive and read a lot. Can you give us your top 3 books that you recommend?
There are a ton. Things that I think are really interesting and foundational. I like Barbarians to Bureaucrats by Lawrence Miller. It's a book from the 80s. I like Crossing the Chasm by Jeffrey Moore about technology adoption, and his follow-on to that was Inside the Tornado, which was great. I love that. Easy reads. I think it applies to our space. I like How the Mighty Fall from Jim Collins, both Good to Great and How the Mighty Fall. I think that's a really interesting predictor of interesting things that happen, and many others. So if you want to talk afterwards, we'll talk about interesting things. I do think that these things, organizational behavior is about human beings, and you can predict what kind of pressures your organization will come under over time. So you might as well learn from the experience of others.
Wonderful. Let's see how time we are. So I think we're about just about on time. If it's okay with you, or anything else you'd like to share with the audience before we open to Q&A?
No, let's do it. I enjoy good questions. I'm hard to insult. You can do it, but you got to try. You got to put your back into it.
All right. Yes, please go ahead.
Yeah, I've got 2 questions, kind of related. One is, I wonder how many acquisition pastors have been taken at Intuitive over the years after the company grew up and really got going. Secondly, I wonder your product development strategy, was it technology driven, or did you add more indications, to the equipment, or did you try to have a product life cycle where you would, supersede the existing technology on a regular basis? Those are my 2 questions.
Okay, so I'll repeat it just in case you didn't hear it. The first question is, have people sought to acquire us, and how often did that happen? And the answer to that is, I think we were on a lot of people's watch list for a while, and there have been periodic inquiries. But I think should the company be sold is a question for the board of directors. And in the early years, I was an engineer working hard in the bowels of the ship. So I don't think any really serious attempts. Over time, I think the board wanted an independent company, felt like we could do it. We got a little bit lucky there too. I think the company fell, if you think of 2 cement blocks in a walking pathway here as we go, our little seedling of Intuitive fell between 2 of those big blocks. One of them was big capital equipment. Think Siemens, GE, Toshiba Medical. The other one was surgery consumables, think Medtronic and Johnson & Johnson. And I think the big the big capital companies didn't want to touch the patient, and the medical instruments companies didn't want to deal with big capital. And they both left us alone long enough to grow out of our awkward early years. And that was a stroke of luck. That was great. On the product development strategy side, we do a couple of things. If it's going to take us a lot of capital to build a platform, we'd like that to be a multi-indication platform. How come? Because it decreases the amount of capital that we're required to put out, which means that we can pass along some of that capital savings to the customer, the hospital who buys it. If the hospital who buys it gets higher utilization, then their capital costs and service costs per utilization goes down. So you can kind of ask yourself, should you do a simple single indication robot? And you might, but remember, you're putting all that volume on that one indication. If you don't get high volume, that actually is expensive for the customer. So if you can be multi-indication on a high capital intensity project, that gives you an opportunity. If you can do low capital utilization on a single indication that's big enough, you can have a narrower. Does that make sense? So there's that trade-off there. With regard to pacing of upgrades, we always felt like there were three things that we tried to do to time something. We never did it by the calendar. We never went out and said, the new model year for the Mercedes E-Class should be 6 years from now. We never planned that way because it was hard to predict and it didn't make any sense to me. So what we said is we need to do something that improves the technology infrastructure that gives us future growth. We need to do something that allows the customer to do something new in terms of a pure indication. And we've got to future-proof something that we now learned. If we can get those three together, that's time for a platform iteration. Sometimes in the early days, we were learning a lot. It could go fast. Sometimes it gets a little later. We needed a little more time. So it would be accordion-like. But each time we brought it, the engineers are motivated because they're getting a new technology stack and it was ready. Our future forward teams, our teams that are thinking about the next thing, now have a platform they can design on. And our customers are the beneficiary of some new indication that we couldn't otherwise get.
Thank you. Any other questions? Let's go ahead.
Awesome, thanks. So my question is, in the current landscape, we're seeing coverage policies start to narrowly define who qualifies for particular interventions, particular surgeries. So I'm wondering how that's flowing into this world of surgeon innovation that you've been talking about, where more and more off-label style indications or experimental uses of a technology are becoming administratively examined by insurance and payers.
Yeah, there's two different meanings of off-label, so let me just do a clarification here. One of them is the medical regulatory authority versus reimbursement. That one, there are bright lines that say, look, you can or cannot, and surgeons can or cannot. I think coverage is different. Different payers and different systems will decide what they view as experimental and therefore not cover. Some countries will not allow out-of-pocket payment for non-listed insurance procedures. So it entirely depends on the country we're operating in. The short answer to that is we have become extremely good healthcare economists. So I think our company now employs, give or take, probably about 50 healthcare economists inside the company whose job it is to work with payers and go through and show them the data. I think everybody is looking for value in the healthcare dollar, euro, yen that they spend. I respect that. If I were a healthcare policymaker on the other side, I would expect that. And so I think we as entrepreneurs and as industry people, we have to meet them where they are. We can't give up, but we have to be very good at economics. And what I was saying in an earlier meeting today, health economics is some of the hardest to get right, because what's listed in electronic medical records, what's listed in billing records is often not the actual prices paid. List prices get paid, assumptions get built into those systems. So understanding true economics is really hard. You have to invest in it. Having said that, we have had enormous success not overnight, but we've had enormous success with payers when we were given the opportunity to present our case, whether it's NHS England or MHLW in Japan or the Blues here in the United States or the German Federated Health System. When we show up with good data that is clinical and economic, we are able to get an audience and to move the conversation forward. It's not easy, but it works.
Wonderful. Let's go ahead right here.
Jack Norman, Fan Society of Northern California. Maybe you can give me the correct version of the success story. I've heard various versions of intuitive surgical. The version that I've heard is that Intuitive raised a bucket of money, created a robot for cardiac surgery. The surgeons didn't like it because if a patient was out, they couldn't get to the patient. Some doctor in Mexico tried it on prostate, and it was a terrific success, and it's been a great success since then. What is the actual story for the early history of
Yeah, that was a deep fake. I think I could challenge every pillar. Let's see. How to be short. I think was really interesting. Dr. Mall, Fred Mall, who is the founder, is a general surgeon by training. And he saw the applications in minimally invasive surgery from day one. And in fact, the system was designed as a generalist surgery system with general surgery and other indications in mind. It was not designed as bespoke for cardiac. So early on, in the earliest design phases, it was viewed as general surgery capable. So that was one. Second thing is fundraising was extremely difficult. If Lonnie were here to speak to what it took to raise a bucket of money, wow, was that hard? And not so. We did pursue cardiac surgery early on, and it was the logic inside the company was very hard to do minimally invasively, very good for the patient. If you don't have to create a sternotomy and you can go through intercostal access, the patient could do really well. It turns out today that, for example, in mitral valve repair, minimally invasive mitral valve repair surgery is being done in, give or take, 20% of US mitral valve cases using a Da Vinci. It's kind of amazing. That said, we found that coronary surgery was technically extremely challenging, particularly with the maturity of the technology we had that day. It's actually on our latest product coming back, but it was really hard. And if we had to operate the company only on that cardiac surgery, it would not have funded itself. It would have collapsed. And it was urologist, he was actually a Swiss urologist operating in Germany. So it was close. His name is Joachim Binder, and he was an open surgeon. He saw this. It was used for cardiac surgery in Frankfurt, and he said, I think I could do minimally invasive urology with it. And he started to pursue urologic approaches, mimicking what they did in laparoscopy, but it was very technically challenging to do laparoscopically. And so he started it, and then he was visited by several people, one of whom was Dr. Manny Menon out of Henry Ford Hospital. And Dr. Menon really perfected the technique, really drove the first sets of real data set. And it took off from there, and that gave us an adopting procedure. See the prior reference to crossing the chasm. We crossed the chasm in robotic prostatectomy. That funded the company and allowed us to do additional things. Thank you for giving me a chance to correct the record.
Back there, we got two next to each other.
Thanks. You have a wonderful profit margin in comparison to some of the peer companies, and I was wondering how you managed to do that and whether you managed to sustain that over the next years.
Yeah, so if you just kind of look at our P&L, if you went and looked at the financial statements, what you'd find is gross margins run around 68%, which is relative, if you call our peer set, J&J MedTech and Medtronic and Stryker and Boston Scientific, is slightly lower than them. It's actually not in pricing. Then you look at R&D, we run R&D at about 11% of revenue. It's a little bit higher. We're actually spending more R&D than most of our peer companies. I think we're the highest of that set, and we may go even higher still. So wait a minute, our margins are lower than our peer set, and our R&D spending is higher. So where's the only other place? SG&A. So our SG&A is lower than our peer companies. And if you go, why is that? It's not so much that our sales model is that different than theirs, but we have a highly concentrated portfolio. So we're not selling 8 divisions worth of different products. We're quite narrowly focused. And there we took inspiration from Apple and Steve Jobs. Have a narrow product set and make it really good. So that allows you to manage your expenses. And so we do that, and we try to be, on our administration functions, we try to be highly efficient and do really well. So that's what it looks like. Can we sustain it? I don't know. That's our job to keep working on it. But, you know, it goes up and down. It depends a lot on platform launches and timing of entering new markets. And so it's not a steady.
Hi, my name is Hiro from Showa Medical University from Japan. I have a question about why intuitive is still being the number one in the robotic surgery industry, because the reason is, there are 2 types of innovation, and once someone's opened up a door, more, so many follow-on players are coming in, the disruptive market. But the other, still the first player, keep other like a top player. And then the intuitive is a latter case. And then what is the secret of this?
Yeah, I'm not sure it's a secret. I agree with you that once you prove something is viable, then people are interested in engaging. And I think that it's really interesting to think about competition. What does competition mean? For us, I think the most relevant economic competition clearly is different approaches to disease state. All of us are patients in our day-to-day life. And what happens, we experience something, we go searching for solutions. We don't care if it's robotic or immunotherapy or radiation oncology. The technology is not at all important. What's important is, what does it do for us? And a great example is GLP-1s. GLP-1s came out, started to have real success. We had a business in bariatric surgery, and that business has declined, as patients move to GLP-1s. And were I a patient for that, and I'm maybe headed that direction, then clearly you'd say, I'm going to go evaluate that, and we'll see. I think surgery will still have a place. I think it's okay. So that's the first one. That's why we really focus on patient outcome rather than just people who make products that look like ours. Because in the end, the patient's going to determine that decision. So that's one layer. Then there are others who say, hey, this idea of computer-aided intervention with really sophisticated mechatronics and offline compute, let's just call it that, there's opportunity for that. There are at least 250 commercial companies doing interesting things in interventions, some of whom are great Japanese companies, some of them are in China, some of them in Europe, some are in Latin America. So it's really interesting. And there you start saying, okay, we need to be effective. To think about how to analyze it, there's a book called 7 Powers. It's a strategy book. Anybody heard of the 7 Powers book? Really helpful. So I think if you read 7 Powers, you start saying, okay, how do you position the company for long-term success? And I think that's an interesting guide. Hospitals and patients have choice. All of us as consumers want choice. I think you all want to evaluate that. And even a great customer who really appreciates us, I hope Katie does, would go out and say, let me evaluate what's on offer. Why not? Let's see what they got. And if they outperform you, my loyalty is to my patients. My loyalty isn't to a company. And that is exactly right. So I think there it comes down to, can we satisfy the needs of the customers highly effectively? And if we can, then we will continue to be first choice, and that's our hope.
We got time for about one more question, so we'll come down over here.
My name is Victor Gerik. I have 2 questions. As you were from the beginning in the company, can you describe the moment when you as a team decided we have a product and we are ready to launch it in the market? And second, can you tell us who were your first 10 clients where you sold the platform?
Yeah, I think both of those are extremely hard questions. Is there a clear moment when you say you're ready? I think in our space, in that first phase, you hear around here, minimum viable product. Any of you heard that phrase? Yeah, MVP. So there's a discussion inside that says, look, these are the minimum requirements before we know we're ready. Among them, of course, is safety. Is this safe? Is it trainable? Can we bring it to market in a way that's going to build strength? That's one. There's a little bit of value statement. Are we bringing something that's enough differentiated in value that people want to do it? So but that's a debate. It's not a preset thing, and it was subject of heavy debate inside the company. And in the early days, I think in year one, Lonnie said, if I'm remembering right, he had 14 contracts he could sell, and he chose to ship 12. And he said, I don't want to overextend the organization. I just want to see how many of these 12 might come back. So even when he said we're ready, he was holding a little bit in reserve to go do that. And I'm sorry, your second half I've lost.
How you convinced the first 10 clients, or
Who were they? Yeah, rather than talking about who all the names were, I think what are the attributes of those folks? I think they were dissatisfied with the status quo. That's how you could tell. And they were saying, they knew these things were going to be a journey of learning. You could come, if I showed you pictures of those first 10 systems, my goodness, you'd go, are you sure you're ready? They were people who were saying, we cannot get there from here. And they were driven and passionate. And for us, a good choice was somebody who knew it was a learning journey, as opposed to the biggest name on the biggest stage. And that has always been true.
Wonderful. Well, thank you so much. Josh, you want to?
Yeah, sure. Oops, I'm going to turn this on. So first of all, fellows and students here, I want you to recognize how special a moment this is, okay? In my life, I think I've only met one other person who's been on a journey like Gary's, John Abel. And this is someone who, employee number 11 to 17,000, and in the same company, and been a part of that growth and been a leader in it. So, like, that's incredible in our industry and really, really special. So I'm just incredibly honored that you would be here, Gary, with us to tell that story. I have one question for you, which is, when you think about that journey, and you think about the, sort of the principles along the way, can you share with us some of the guiding principles in your leadership through this entire incredible journey? I think it would be wonderful to hear your thoughts.
Things that I've learned from others that have just stuck with me over the years. I think I learned from Lonnie, if you're going to lead, it's about the mission first every time. And it was amazing. So we worked together on some very stressful things. And I would call, every once in a while you get possessed by anxiety. It's a heart pumping good. And I would call him at Friday night at 11 p.m. And never once did he ever go, I'm exhausted, you're interrupting a family dinner. I would text him, and he'd text back, I'll step out and I'll ask you a question. And his first question, every single time, no matter what, ever, tell me the problem, how can I help? And that really struck me as a young person. He's in it for the mission. And I aspired to that. I was like, okay, we're mission oriented. And then I heard from one of our salespeople, he had grown up in a really strong family and an athletic family, and he had told the story that, of his kids. He was coaching his kids, and he said, look, when you go out on the field, just remember, the name on the front is the name of your team. That's the front, mission first. The name on your back is your family name, and whatever your stat sheet is, your personal name. So what does that mean? That mission first, take care of your team, and then develop yourself. Just structured that way. And it's really clear when you say it out loud. Take care of the mission, take care of your team, serve yourself last, and develop yourself. How many of you see that practiced daily in organizations when you walk around the world? I think it's rarer than it should be. It's not unheard of, but it's rarer than it should be. So just reminding that it's not about one person. None of this can be done. I'll end with the following thought. How many of you know how many human beings at Stanford Hospital have to do the right thing the day of surgery when one of my family members comes in and gets that surgery? How many people in the workflow somewhere have to take an action that helps them get a good result? Any guesses? Somebody help, otherwise go on forever. 20. 60? Yeah, closer to 60 than 20. So just one event, one surgery is 60 human beings. So you think about the star surgeon, they're relying on 59 other people to also help. That's also true in companies. So if I've learned one thing, it's trust your neighbors, invest in them, satisfy the mission, and if you do, everything rises.
That is a fantastic way to end. Thank you, Katie, for a great interview, and Gary, thank you so much for sharing this with us. I really appreciate everyone being here. Just a thank you again to Wilson Sonsini, Guthart, and Rosati for supporting us, and the amazing team of Deja, Danny, and Awo that put this all together. Meghana, Linda, Jill, Marcella, and Susie. Thank you all, and stay tuned. Follow us on Instagram and also on LinkedIn for our future events that will be coming up in the coming months ahead. And thank you all. Have a great night. Thank you.
Thank you.